Looking after our mental health is just as important as taking care of our physical health. There is more and more evidence now showing that stress and poor mental health can have an impact on various aspects of our physical health. The coronavirus, COVID-19 outbreak means that life is changing for all of us. The uncertainty around the current situation may cause you to feel anxious, stressed, worried, sad, bored, lonely, or frustrated. It is important to remember it is okay to feel this way and that everyone reacts differently. Remember, this situation is temporary, and for most of us, these difficult feelings will pass. Through this presentation, we will cover some simple things you can do to help you take care of your mental health and well-being during times of uncertainty. Doing so will help you think clearly and make sure you are able to look after yourself and those you care about. Maintaining healthy relationships with people we trust is important for our mental well-being, especially during times of uncertainty and fear. Fear and isolation can have a serious impact on our mental health. So think about how you can stay in touch with family and friends while needing to stay at home. You could reach out to family members, friends, and colleagues via regular phone, text, FaceTime, or other social media platforms. Difficult feelings are guaranteed to keep showing up as this crisis unfolds. Fear, anxiety, anger, sadness, guilt, loneliness, frustration, confusion, and many more. We can't stop them from arising. They're normal reactions. But we can open up and make room for them. Acknowledge they are normal. Allow them to be there, even though they hurt, and treat ourselves kindly. It is okay to share your concerns with others you trust, and doing so may help them too. If you cannot speak to someone, or if doing so has not helped, there are plenty of helplines you can try instead. In addition to social, there are also financial implications of staying at home, which can have an impact on our mental health. To help you feel more prepared and less concerned, think through a normal week. How will it be affected? And what do you need to do to solve any problems? If you have not already, you might want to talk to your employer, understand your sick pay and benefit rights. You could also think about who you can get help from locally, as well as people you know. Lots of local and community help groups are being set up. Try to remember, this disruption should only be temporary. Stick to the facts. Gather information from credible sources you can trust, such as gov.uk or the NHS website, that will help you accurately determine your risk so that you can take reasonable precautions. Limit the time you spend watching, reading, or listening to coverage of the outbreak, including on social media, and think about turning off breaking news alerts on your phone. You could set yourself a specific time to read updates or limit yourself to a couple of checks a day. Spending too much time watching or listening to media coverage will increase your anxiety. Concern about the coronavirus outbreak is perfectly normal. It is natural to have many "what if" questions in your minds. However, some people may experience intense anxiety that can affect their daily life. In the absence of information, our anxious mind will often fill in the blanks with worst-case scenarios, which can leave us feeling overwhelmed, helpless, or vulnerable. Try to keep things in perspective and think about what you can control, such as your behavior, who you speak to, and where and how often you get information. It is fine to acknowledge that some things are out of your control, but if constant thoughts about coronavirus are making you feel anxious or overwhelmed, try to manage your anxiety through relaxation, meditation, and/or distraction. Our physical health has a big impact on how we feel. At times like this, it can be easy to fall into unhealthy patterns of behavior that end up making you feel worse. Try to eat healthy, well-balanced meals, drink enough water, and exercise regularly. Spend time daily in nature, like a local park or your garden at home, adhering to government guidance. While gyms are currently closed, you can leave your house, alone or with members of your household, for one form of exercise a day, like a walk, run, or a bike ride. But make sure you keep a safe distance of 2 meters from others. There are lots of exercises you can do in the comfort of your own home. Good quality sleep makes a big difference to how we feel mentally and physically, so it is important to get enough. Try to maintain regular sleeping patterns and keep up healthy sleep habit practices, like avoiding screens before bed, cutting back on caffeine, and creating a restful environment. If we are feeling worried, anxious, or low, we might stop doing things we usually enjoy. Focusing on your favorite hobby, relaxing indoors, or connecting with others can help with anxious thoughts and feelings. If you cannot do the things you normally enjoy because you're staying at home, think about how you can adapt them or try something new. There are lots of free tutorials and courses online, and people are coming up with inventive new ways to do things. Focusing on the present rather than worrying about the future can help with difficult emotions and improve our mental well-being. Relaxation, mindfulness, and meditation can help us to focus on the present. There are many ways to practice meditation, and there is no right or wrong way. Some may find it difficult to switch off from their thoughts, and in this case can try a short, guided meditation. Our daily satsang practices such as smriti, mansi, dhyan, etc. are all helpful in supporting you to remain in the present moment and manage difficult emotions. You don't need to do any of the above for a very long time. Even 5 to 10 minutes daily will help with calming the mind. Mindfulness. Anytime you are feeling anxious or stressed, take a short moment to focus on your breathing, which will bring you back to the present moment. Or practice pranayama breathing. When we are feeling worried, anxious or low, it is easy to think about the negatives, particularly during difficult times like this. But make it a habit to think about the positives, such as being able to do more satsang, spending more time with family, an opportunity to learn something new. Draw on skills that you have used in the past that have helped you to manage previous life adversities, and use those skills to help you manage your emotions during the challenging times of this outbreak. Helping someone else can benefit you as well as them. Showing care towards friends, family, or vulnerable people in our community can be all the more important during times like this. It can foster a sense of hope, purpose, and meaning. Some ideas can be to make a phone call, send someone you care about a message of encouragement or affirmation, cook, pack, and deliver a meal to someone in your neighborhood. As per Brahmok Swami Maharaj's motto, "In the joy of others lies our own." Remember, it is important to do this in line with the official coronavirus guidance to keep everyone safe. There are plenty of things you can do and places to get more help and support if you are struggling with your mental health. You can contact your GP or mental health helplines such as the free 24-hour helpline Samaritans on 116 123 or Sane Line on 0300 304 7000, which is available daily between 4:30 p.m. to 10:30 p.m. You can also find coronavirus staying at home tips on the NHS website displayed in this presentation. Don't forget that this will not last forever. Be kind to yourself and take each day as it comes. Remember the positives, support and help each other, and seek guidance when you find yourself struggling with your mental well-being. Remember, we are all in this together.